can we integrate these things into our life long term so that for the remainder of our life, we can live a different lifestyle and we can feel something different.
Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about fibromyalgia. This is something that affects many people, and we want to be able to guide in a little bit of education based on what the research is saying today. Before we explain where fibromyalgia really comes from, how you get diagnosed, and what you should really be focusing on to really help, I want to make sure that you don't miss out on future episodes that we have or past episodes that we've had. We have so many of these and just regular videos about, if you have pain during an exercise or if you want to increase your mobility in a certain way. We have so much education on this channel, so don't forget to subscribe. And if you have more questions as we go through or you want to see us cover something else, please comment below, because we need to know from you what you want to hear about.
All right, so today we're going to be talking through fibromyalgia, and we're going to try to do this in a relatively concise way because it's such a big topic based on what fibromyalgia is and what the research is saying as what are the best ways to show improvement in some of the symptoms that people feel. And I just want to start by saying, like, Jen and myself, we don't have or have not experienced fibromyalgia, so we're not going to try to act like we can relate to or understand what people who are living with fibromyalgia go through as far as the physical, emotional, and potentially financial toll it takes on them.
We have to just be very sensitive and not say, oh, it's so easy. You can, that's like telling someone with depression that they could just get over it and they can do these simple things and it'd be fine.
Put a smile on.
It's not that easy. So we just want to go through objectively what the research is really saying that could be the most beneficial, and maybe some techniques that aren't showing to be as beneficial.
Yeah, so first, what is fibromyalgia? And really what it boils down to is it's an abnormal pain processing in the body. A term that has started to come more as synonymous with fibromyalgia is central sensitization, which is essentially where our central nervous system is riding high. And we kind of talk about this related to other pain disorders, but our whole central nervous system is just riding high, so our pain threshold is very, very minimal. And that's where the smallest things, the smallest stimuli can cause us to have pain. Even things that we wouldn't think would cause pain can put us above that threshold. And it's kind of this random and diffuse pains that we feel all over the body or in multiple different areas of the body.
Exactly. Typically what you're experiencing are general musculoskeletal, so somewhere, muscle-wise that you're feeling along the body, not necessarily like a joint restriction or something. It's more muscular related and in the pain within the body. And we usually see it in at least 4 to 5 areas of the body in order to determine, that this is a fibromyalgia.
When we looked at what the risks are of either developing or having fibromyalgia, one was very low levels of activity or intolerance to activity. And then the second one was having a very low perception of your health.
Things that shouldn't cause pain are causing pain, like a light breeze or, something that you wouldn't think normally would cause pain.
Or if someone grabs your shoulder, it could cause searing pain down your shoulder and back.
Or a light massage, light touch.
And that's called allodynia, is the term that we use for when you have a sensation, like if someone just puts their hand on your shoulder or your back and you feel pain. Not something that we would normally think would cause pain. Also, symptoms that can be very common are fatigue, issues with sleep or poor levels of sleep, depression, anxiety, just generally low quality of life, low social activity, or it affects your social activity, and even economic repercussions because of maybe going to a lot of different medical providers or seeking out different medical treatments to try and figure out what's going on. We should talk about what success looks like for a patient like this. And as we mentioned, there's so many different areas someone can be having symptoms. They can be having pain, yes, but very low levels of functional or physical ability, poor levels of sleep, depression or anxiety, emotional stress, lower quality of life. So success can look like seeing improvements in any of these areas.
Exactly.
Right? A lot of us will want to see improvements in all of these areas quickly. And that might just not be the case because fibromyalgia is something that develops over time. And so if we are improving our physical ability and physical function, and it's allowing us to do more socially, but we're still having pain, yes, we're still having pain. And there can be a lot of things that, we need to deal with in that realm as far as our understanding of pain, our coping mechanisms for pain, but we're doing more. We're functioning more. We're able to do more socially. And that's improvement. movement. That's on the right path.
A lot of people who have fibromyalgia, that is how they see it. Like, oh, I live with pain. Like, this is my life. But if I can improve my quality of sleep, if I can improve like just being able to get myself to some movement, if I feel like a little bit better, a little less fatigued, a little happier, even though I'm still living with pain, like those can be high measures of success.
So there's 3 kind of buckets that we wanted to look at when it comes to components that we think are great for people to incorporate if you're looking to find successful outcomes long-term.
Based on what the research is showing.
Based on what we're seeing in the research. And those 3 buckets are exercise, psychology, and education. And we're going to give a little bit of what falls under each of those buckets. First bucket is exercise. And I think it's the European Alliance of Associations for Rheumatology.
Woo.
Right?
Good job.
Big acronym that I have to spell out there, but they strongly recommend exercise. And I think just talking about what exercise does in general, it gets our joints moving, it gets our blood moving, it gets our lymph moving. It helps load that nervous system a little bit so that our nervous system can start to adapt to that. And I think where exercise is difficult is people are in pain, people have fatigue. Yeah. People aren't sleeping well. Why would I want to exercise?
Right. It's kind of backwards in that thinking in that way. But at the same time, if we start to push the needle just a little bit and tap into some of those pain symptoms that we're having when we're doing movement, we can start to get a different feedback into our body. So we can actually start to change those pain signals that we're feeling. And especially if we start with something like aquatic therapy. So if we're going and we're in water, that can start to have a different impact and a different sensation of our body, because now we have buoyancy, we have different pressures on our body as we're starting to do movement. There's so many different exercise protocols that the research calls upon. And it's almost like, well, what feels good for you? What do you enjoy? Because if you don't enjoy something and you're like, well, it said I had to strength train, so I have to strength train, but I hate it every single day.
Yeah. Again, that's going to be tough to stay with. And something that we're also seeing in the research is that if you stop the physical activity, the benefits will slowly go away. So it's something that needs to continue to be incorporated on an increasing basis. And I love that you started with aquatic therapy, because low impact, water is very soothing on the nervous system. Water helps mechanically gate pain. It gives you something different to feel, so it can really help with pain. And when we were looking through some of these meta-analyses or these big collections of studies that compared all sorts of different treatments, it said land therapies and aquatic therapies showed similar benefits. Strength training and aerobic exercise showed similar benefits. Even a study that showed that 30 minutes of self-selected activity done, I don't know if it was daily or a certain amount of times per week, showed benefits in physical function and pain reduction. But again, that specific study said after the study was stopped, 6-month and 12-month follow-up didn't, showed that some of those benefits went away. Well, yeah, because we stopped the exercise.
We saw research in terms of strength training, but not just, again, a 4-week program or a month program. This was a 21-week program where you started in a lighter intensity. So you had higher reps from like 10 to 15. You only went about 40 to 60% of your 1 rep max. And then we slowly started to increase that. So from 4 to 12 weeks, now we're going a little bit higher or lower reps. So 8 to 12, because we're bumping up the intensity. And then at the very end, you only went 5 to 10 reps because we're going like 70 to 80% of your 1 RM.
One thing about exercise that I love is that it's hard to separate it from your mind and the mindset and the emotions. And we see that in what are called, more the mind-body types of movement, like yoga, like Tai Chi, like Zumba, Pilates, where you're a little more tuned into what's happening in the body. And it just adds that extra layer of mindfulness. And again, in what we saw in a lot of the studies were that people who really struggled to stick with a program, they would have lower levels of self-efficacy, because they're like, oh, wow, I can't do this. I'm trying, I can't even do the exercise, fail, then we go back to doing nothing. So setting somebody up with an exercise program that helps them feel like they can is so important. And that kind of comes down in the education bucket.
Sometimes we're so overwhelmed, say you are depressed, you're not sleeping well, and I'm supposed to choose what I'm doing every single day. That's going to be really hard to stick to. And so finding, whether it's going to an exercise group, whether it's finding someone who's also going through this with you, or a group of people who are going through and saying, okay, can we show up and walk every day together? Or can we, what are we going to do that's going to help to assist with that motivation? Because finding that self-motivation when you're going through that much pain is probably going to be really difficult.
And this all lands kind of in that second bucket of the psychology of what we want to be working on. You know, social support, immensely beneficial. And we saw that in multiple studies where having that support group, again, that might be going through similar things, doing similar things, joining into a walking group. Because again, that self-selected 30 minutes of activity, if you're just meeting up with people and going walking every day, can be so beneficial. I thought there was one interesting study that kind of compared a bunch of different types of therapies in this long meta-analyses, and it showed that cognitive behavioral therapy was found to be the most beneficial for decreasing people's depression, increasing their self-efficacy, decreasing pain, and increasing the ability to cope with pain or painful symptoms and the emotional distress that might bring up. And we kind of mentioned that if you're starting an exercise program, it can be very important to be arming yourself with some of these tools to be able to cope if pains still come up, which they very likely will.
Exactly. And that kind of leads us into that third bucket of education. Like, we're trying to put the reins back into your own hands and know that you are in control of your pains and your body as much as you feel like it is overwhelming and it is taking over you. Like, as much as we can do to help educate you into you leading the way for yourself, like that's going to be the biggest change. And I like to, remembering that because this is so chronic and this is so long term that's been happening within your body, or it kind of started to increase over time. This isn't like an inflammatory issue that we're dealing with, right? Studies had shown that using NSAIDs long term really didn't do anything to create change in what we were feeling. So we can't just rely on those pharmaceuticals to do the work for us. We really have to say, okay, how am I going to take control of this in my own hands?
Also, the education that there were different research studies that showed more of the passive modalities, just like massage or acupuncture or
taking all these supplements.
Taking supplements, nutritional supplements, those alone had no effect.
No.
So doing those things isolated and alone had no effect. Again, if that's something that feels good for you and feels like it helps reduce your pain, great. That can be a part of the plan. Other things that should be a part of the plan are the exercise bucket, the psychology support group, social group bucket, and continuing to educate yourself on what might best fit together to help really make you feel like you can take control. So ultimately, and again, based on all the research, a multifactorial approach. The studies that showed that they were integrating all of these buckets, kind of incorporating something physical in the exercise realm, psychological with emotional support, educating along the way. Those showed to have some of the biggest benefits. And again, there was, I think, because a lot of the studies, you can only do it over a 4-week or a 6-week or a 6-month period. It has to be a lifelong thing. Can we integrate these things into our life long term so that for the remainder of our life, we can live a different lifestyle and we can feel something different? Thanks for joining us for another PT Pearl all about fibromyalgia and some of the major things that we found in the research that can be really beneficial. Are you somebody who deals with this on a day-to-day basis? Please comment below. Let us know if anything we said is helpful. Let us know if you have found anything that's helpful. Please feel free to share this episode with family and friends out there. Make sure to click the notification bell and subscribe before you leave, and we'll see you next time.